Hello, future nurses. Let's review the 10 must-know cardiac NCLEX question. Let's start with question number 1. A client is 4 hours post-myocardial infarction, or MI, and reports new onset, shortness of breath, restlessness, and frothy pink sputum. Which action should the nurse take first? A. Obtain a 12-lead EKG or ECG. B. Elevate the head of the bed. C. Administer prescribed furosemide IV. Or D. Auscultate heart sounds. Okay, so let's look at the correct answer. The correct answer is letter B, elevate the head of the bed. This is the rationale. The client is showing signs of acute pulmonary edema. The clinical features was frothy, pink sputum, dyspnea, and restlessness. So this is a life-threatening complication that impairs gas exchange. Elevating the head of the bed immediately improves ventilation and reduces venous return to the heart, offering rapid symptom relief while other interventions are prepared. Question number 2. A nurse provides discharge stitching to a client with chronic heart failure who is being started on furosemide and lisinopril. Which statement by the client indicates a need for further teaching? Letter A. I will weigh myself every morning using the same scale. Letter B. I will call my provider if I gain 3 pounds in 2 days. Letter C. I will use salt substitute so I can season my food more. Or letter D. I will change position slowly when getting out of bed. The correct answer is letter C. I will use a salt substitute so I can season my food more. This is the rationale. Many salt substitutes contain potassium chloride, which can increase the risk of hyperkalemia in clients taking ACE inhibitors such as lisinopril. Or question number 3. The nurse is assessing a client with suspected left-sided heart failure. Which finding is most consistent with this condition? Letter A. Jugular vein distension. Letter B. Dependent edema in the ankles. Letter C. Dyspnea on exertion and crackles in the lungs. Letter D. Hepatomegaly and ascites. The correct answer is letter C, dyspnea on exertion and crackles in the lungs. Rationale. Left-sided heart failure leads to pulmonary congestion because the left ventricle cannot effectively pump blood into systemic circulation, causing fluid backup in the lungs. This results in dyspnea, orthopnea, and crackles on auscultation. Let's go to question number 4. A client with newly diagnosed hypertension is prescribed beta blocker, an example of which is metoprolol. Which client statement indicates understanding of this medication? A. I can stop this drug if my blood pressure returns to normal. Letter B. I should check my pulse and notify the provider if it's below 60. Letter C. I will take this medication only when I feel palpitations. Or letter D. This drug may cause potassium level to go high. Okay, the rational is the correct answer is letter B, and this is the rational. Beta blockers decrease heart rate and contractility. Clients should monitor pulse and report bradycardia, usually if the heart rate is less than 60 per minute or dizziness. Let's go to question number 5. A client with a history of stable angina reports chest pain at rest that is not relieved by one sublingual nitroglycerin tablet after 5 minutes. What is the nurse's priority action? Letter A, administer a second nitroglycerin tab. Letter B, document the response and continue to monitor. Letter C, instruct the client to rest quietly for 30 minutes. Or letter D, encourage deep breathing exercises. Okay, the correct answer is letter A, administer a second nitroglycerin tablet, and this is the rational. Current guidelines allow up to 3 nitroglycerin dosages, 5 minutes apart, while closely monitoring symptoms and blood pressure. Let's go to question number 6. A post-operative client suddenly reports cough pain, warmth, and swelling in the right leg. Which nursing action is most appropriate? Letter A, encourage ambulation to improve circulation. Letter B, elevate the affected leg and notify the provider. Letter C, massage the cough to relieve discomfort. Or letter D, apply a heating pad to the affected area. Okay, so let's look at the correct answer. The correct answer is going to be letter B, elevate the affected leg and notify the provider. And this is the rational. The client's symptoms are suggestive of DVT, which is deep vein thrombosis, which poses a risk of pulmonary embolism. Elevating the leg promotes venous return without dislodging the clot, and prompt provider notification is required for diagnostic testing and anticoagulation therapy. Let's go to the next question. A client comes to the emergency department with chest pain radiating to the left arm and jaw. Which laboratory test is most important for confirming a diagnosis of acute myocardial infarction? Letter A, creatinine kinase, which is CK. Letter B, either troponin I or troponin T. Letter C, C-reactive protein or CRP. Or in letter D, myoglobin. Okay, so let's look at the correct answer. The correct answer is going to be letter B, which is either troponin I or troponin T. And this is the rational. Cardiac troponins are the most sensitive and specific biomarkers for myocardial injury and are considered the gold standard for diagnosing acute MI. Let's go to question number 8, which is a post-cardiac cath care. A client has just returned from a left-sided cardiac catheterization via the femoral artery. Which finding requires immediate interventions? Is it letter A, soft non-tender hematoma at the insertion site? B, complaints of mild back discomfort? Letter C, diminished vital pulses and a cold pale foot on the affected side? And letter D, blood pressure of 110/68 and a heart rate of 88. Okay, so let's look at the correct answer. It's going to be letter C, diminished pedal pulses and cold pale foot on the affected side. So this is the rational. Diminished pulses, coolness, and pallor indicate compromised distal perfusion, suggesting arterial obstructions or thrombus formation and requiring urgent evaluation. Let's go to the next question. A client with heart failure is taking digoxin. Which assessment finding should prompt the nurse to hold the medication and notify the provider? Letter A, heart rate of 88 per minute and regular. Letter B, serum potassium of 4.2 milliequivalent per liter. Letter C, anorexia and nausea with a heart rate of 52 beats per minute. Or letter D, mild pedal edema that worsens in the evening. Oops, sorry, I forgot. So the answer already. So let's have 10 seconds here. Okay, y'all, the correct answer is letter C, anorexia and nausea with a heart rate of 52 per minute. And this is the rationale. Early signs of digoxin toxicity include anorexia, nausea, vomiting, and bradycardia. The medication should be held and the provider notified for additional orders and possible serum potassium level checking. Let's go to our next question. A nurse is teaching a client with peripheral arterial disease, or PAD, about lifestyle modifications. Which statement by the nurse indicates correct understanding? So letter A, I should elevate my legs above my heart whenever I sit. Letter B, I will avoid crossing my legs and will dangle them when pain occurs. Letter C, I should apply tight elastic bandages to reduce swelling. Or letter D, I will increase my fluid intake to 4 liters per day. Okay, boom. The correct answer is letter B. I will avoid crossing my legs and I will dangle them when pain occurs. Rational. In PAD, arterial blood flow to the extremities is impaired. Dependent positioning, such as dangling the legs, can improve perfusion and relieve ischemic pain. If you like contents like this, please like, follow, and subscribe. Thank you.